Dr. Churitan.
I'd like to jump right into this IGeneX test that I had sent over. My general practitioner and I are having a bit of difficulty understanding whether this is an indication that I should pursue Lyme disease treatment, whether it's negative and I'm okay in this regard and should pursue some other.
Yeah, I see what you mean. So the IgM Western blot is definitely negative. Band 41 tends to cross-react with other kinds of microbes because it is the protein that makes the flagella, which is like a little thing that bacteria use to get around.
Okay.
And other kinds of bacteria have that. The other one, so it looks like you don't have two or more of the starred bands. You only have one of those, so that is a negative result by IGeneX standards as well for the IgG.
Okay.
And then the IFA, yes, does look like it's positive. So
when you say the ISA, where is that on the report? I'm kind of flipping along with you here.
It is on page 2 at the bottom.
Okay, where it says IFA. Okay, yes.
Yeah, so my understanding is that that can happen even when some of the proteins that are being detected are the ones that are cross-reactive, like band 41. So really, the Western blot is better, or the immunoblot is better than the IFA at really making the decision about whether or not someone should consider that they have Lyme disease. Now, it looks like you have immunoblot 2, so let's look at that.
Okay.
Okay, yes, so that your immunoblot, IgM, is positive by IGeneX standards, so that's significant. The immunoblot is thought to be more sensitive than the Western blot, so it is common for the Western blot to be negative and the immunoblot to be positive, because the immunoblot is just better at detecting the proteins that they're looking for.
Okay.
And then on your immunoblot IgG,
okay.
you have 2 or more of the starred bands, so that appears to be positive too. And then infection. Anaplasma result was equivocal, so I can't really say one way or the other.
Which one was that?
If you go down to page 6 out of 7,
okay,
where it says HGAIFA,
yes,
you have one of your results as 160, which, as it says, may or may not suggest active infection.
okay.
And then, so that's anaplasma. That's what that organism is they were testing for. And then, looks like you had some positives for Bartonella, which are listed there. And you had an equivocal result for rickettsia, so they can't say one way or another whether that infection is active. So yeah, I would say, based on these results, your Lyme testing is positive. So here's the way that Lyme testing works.
Okay.
We have all these different kinds of tests, and many times as doctors we will use multiple tests. And the reason is that the sensitivity of all these tests is so low. And the sensitivity means when the infection is there, we don't detect it all the time. So that means low sensitivity. So all of these tests, we think they detect Lyme disease somewhere in the range of 30 to 60% of the time when it's there.
Mm-hmm.
And there's multiple reasons to that. One is that the organism likes to hide in the tissues, right, once it's become a chronic infection.
Okay.
2 is that it is really good all the different ways that it derails our immune response so that we can't fight it very effectively. It's fascinating, actually. But so that's the other reason that these tests are often not picking it up, because most of the tests that we do for these infections are immune-based tests. So we're looking at the immune reaction to the bug, not the bug itself.
Got it.
Yeah, so when you have a positive result on either a Western blot or an immunoblot or on an LE spot or on a PCR, these are all the different kinds of tests we use for Lyme disease. If any of those is positive, that's considered a positive because it's so hard to detect it.
Okay.
Yep. So, yeah, and as you can tell here, when you were looking at the Western blot for Lyme disease, it was listing IGENIX criteria and it was listing CDC criteria.
Yes.
Right? And so the reason for that is that when we developed a vaccine and briefly offered a vaccine to the public for Lyme disease, there were certain of these bands that would have made the test positive just because somebody had had the vaccine.
Okay.
So they took those bands off of the test, and even though the vaccine is no longer given, they never put the bands back on there.
Oh.
So IGENIX is wonderful because they test for all the bands.
Yes.
And the CDC doesn't really look at all those. So if you were to test with LabCorp or something like that, you wouldn't have as good of a test.
Okay.
Yeah.
Okay, very good. And so for the co-infections, what I thought I heard you say was that they're negative except for one of them?
Yeah, so it looks like you have some positives for Bartonella.
Mm-hmm.
And it looks like Tensillae specifically, and looks like the genus in general. So that just means like all Bartonella types. They can't differentiate.
Okay.
And then you had a few equivocal results, which basically means, well, you're having an immune reaction to this, but it's not as high as our typical cutoff for active infection. So that may mean that you were exposed to that infection and your body's already dealt with it.
Okay.
Or it may mean that you have that infection, but your body is having a hard time mounting an appropriate immune response to that infection.
Mm-hmm.
So, yeah, there's a couple possibilities there.
And so based on these test results for the Bartonella specifically, would you suggest treatment for that Bartonella?
So they say here, you know, if 2 or more Bartonella species antibodies are detected, then they consider that a positive and they consider that you should treat. Now, you had one specific species and you had one general, so that might only actually equate to 1. I think they actually said...
I hear you.
I think that only equates to 1
Okay.
total. So basically what I would do in this situation is if you have the symptoms that are consistent with Bartonella and you have risk factors for having Bartonella, such as a tick bite, or, you know, you've had a lot of exposure to cats, because Tensillae is the one that cats usually carry as well, then yes, I would suggest treating it.
Okay. And what is treatment for the Bartonella, please?
Well, it's varied quite a bit. So some people use antibiotics for Bartonella because it is a bacteria. Some people use herbs.
Mm-hmm.
And it really depends on the practitioner quite a bit.
Okay.
So for most of these infections, for most people, I'm using herbal treatment.
Mm-hmm.
There's a small percentage of people for whom I use antibiotic treatment. But for most people, I'm using herbal, and that works well for a lot of people.
Okay.
There are a couple other specialty treatments I do as well, but yeah.
Okay. And what is the antibiotic treatment?
So there's a number of different protocols, and you actually typically usually pulse or rotate them. Does your doctor treat Lyme disease?
She does only insofar as working with a specialist. She says she's had one other patient that had Lyme disease and was going to a naturopath, and so she was coordinating with the naturopath for that patient's treatment. But
Okay.
she's not a specialist in this in any way, although she's very open-minded and cooperative toward, helping me with this.
Okay, yeah. So for antibiotic treatment, I often use the guidelines that are given by ILADS, the International Lyme and Associated Diseases Society.
Okay.
I also use protocols published by Dr. Richard Horowitz, who's been treating Lyme disease for over 30 years with antibiotics. And Dr. Marty Ross actually has a great publication with the different protocols for treating the tick-borne infections also. Okay. So I reference those, and I actually don't have them off the top of my head because I don't use antibiotics very often.
Oh, okay.
So every time I decide I'm going to use antibiotics, I reference those 3 references.
Okay, okay, very good. And are the herbal treatments also the ILAD guidelines and such?
No, ILADS actually doesn't give any herbal treatment guidelines because ILADS is primarily a medical doctor organization, and they're trying to remain legitimate in the eyes of the conventional medical community.
Yes.
And so they don't venture out that way. Mm-hmm. That being said, at their conferences, they're now having a lot of lectures about integrated medicine for treating Lyme disease. But for herbal medicine protocols, there's a lot in that regard too. So Stephen Harris-Buhner has some published ones that are effective.
Okay, and I heard you said Stephen Buhner before. Would you spell his last name?
Yeah, it's Buhner.
Okay, very good.
So I use his sometimes. I also use a lot of products designed by Beyond Balance. Mm-hmm. Or Byron White, and both of those herbal companies specialize in making formulas for these infections, and they actually name them after the infections. They're very specific to which infection you're trying to treat, so they have Bartonella-specific formulas.
Yes. So my next question about Bartonella specifically, and I have lifelong exposure to cats, and right now I have 7. So my concern would be if I treat the Bartonella, what's the possibility of recurrence because of re-exposure?
Yeah, there's definitely a possibility of recurrence. You know, in that kind of situation, what I would actually suggest you do is you do a combination of both treating the Bartonella that you have in your body and then doing an immune-based therapy that retrains your immune system to deal better with Bartonella. So that if you are re-exposed, you have a more appropriate immune response to it and hopefully don't develop an active infection from it. Okay. So what I use for that purpose is called low-dose immunotherapy, which is a therapy designed by Dr. Ty Vincent.
By Dr. who, please?
Ty, T-Y, last name Vincent.
Okay.
And he has some great videos online about how the therapy works, but it's basically using homeopathic combinations of different Bartonella species to retrain the immune system to actively deal with that infection better.
Very interesting.
Yeah.
Yeah, that's very interesting. Okay, great. And then as far as, stepping back to Lyme in particular, I'm trying to recall, would you, looking at my test, would you treat me for that? For Lyme?
Yes, I would.
Okay, because of this immunobot reading. Okay. And in general, what's your antibiotic treatment for Lyme?
So that also tends to vary and rotate. So that's kind of really important with all of these infections because they, and especially with Lyme actually, because it has those multiple forms that it can rotate between and because it's very good at hiding and becoming resistant to antibiotic treatment, you actually have to switch it up regularly. So you need to usually use 2 or 3 antibiotics at a time, and you usually need to rotate them. And you need to use one that is targeting the intracellular space. You need to use one that's targeting the cell wall, and then you need to use one that's targeting the cyst form of Borrelia, which is its most resistant and protected form.
Wow.
Yeah.
Wow. Boy, that is very informative. And is that also an ILAD guidelines protocol?
Yes.
Okay, very good. And similarly for herbs, are there certain protocols you follow for the herbs for Lyme?
Yes, and it's similar to what I had to say about Bartonella.
Yes.
Those are some of the primary herbal protocols I follow.
Mm-hmm.
The last one that I use somewhat frequently, actually there's two others I use somewhat frequently, are lines from BioPure
Mm-hmm.
and Lee Cowden's protocol. I don't ever use the whole protocol because it's really excessive,
Mm-hmm.
but the specific antimicrobials that he uses, I will use those.
His antimicrobials. Okay.
Yeah.
Okay, that sounds great. And do you sometimes mix antibiotic and herbal treatment, or do you kind of go in one direction?
I do sometimes mix, and sometimes I'll be doing both at one time, and sometimes I'll rotate between them. Sometimes we'll do antibiotics for a while, take a break, do herbs for a while, take a break, do antibiotics, like that.
Wow, okay, very good. And so I've had testing for other conditions such as, parasites and mold. I was tested positive for Giardia and was treated for that with metronidazole, and also positive for yeast. I guess kind of what I'm getting at, my understanding is that we should kind of knock out these other complications before we address the Lyme's and the Bartonella. Do you agree kind of with that philosophy, or do you go first for the Lyme's and the Bartonella and then go for other co-conditions?
So one of my mentors taught me to go after typically bigger infections first. If you're not sure what the body's priority is, go after bigger infections first. And by that, he means go after larger organisms first.
Wow.
So typically tackling parasites and yeast before tackling bacteria.
Okay, that sounds good.
Yeah.
And the bacteria would be the Lyme and the Bartonella.
Yeah.
Okay, that sounds good. And then what other sort of hidden conditions might I address except those that I have mentioned? Maybe some other red flags that I might want to address?
Yeah, gut health in general is incredibly important. So I do find that patients, if they can deal with their gut and balance their gut before they start Lyme treatment, they tend to do much better.
Yes.
I also find that if patients start with detoxification
Yes.
before they start treating the Lyme, they also do much better, because as you start killing microbes, you actually require the body to detoxify a lot of the fragments and things that are created by that process. So it's really helpful to have digestion working really well. Make sure you're never constipated.
Yes, okay.
And your microbiome is healthy. And then detoxification. And then if you've got those things in place first, usually treatment is going to be so much easier.
Okay, that sounds great. And dietarily, do you recommend, they say basically, no gluten, no sugar, no processed food, no dairy. Is that kind of where you start dietarily?
Yeah, those are typically the most important things.
Okay.
If I can convince the patient to be along the lines of paleo, I'm even happier.
Okay. Great.
I tend to see people just do the best when they are, most people, when they are eating that way.
Okay, great. And how long should I be on that, strict detox and dietary protocol before I undergo Lyme treatment?
Well, it varies a bit. It really depends on what your toxic load is. So let's say you start doing gut rebalancing, and you're not really sure your gut's doing very well, and you're still 2 months in. You should probably continue for another month or so until you feel like it's doing better. Same thing with detoxification. If you start detoxification and you feel terrible, and you realize, oh my gosh, I have a really big toxic burden, you want to get to a more stable place where you feel like your body isn't so burdened by the toxins before you start killing and mobilizing more toxins.
Okay. And in general, what is your detox protocol that I could start on?
So typically I'll have, if I can convince people to do it, I like for them to do saunas if they're able to tolerate it. I find saunas to be incredibly helpful, so 2 or 3 times a week if you do well with saunas. Not infrared, usually I just do dry heat saunas.
Can I do jacuzzi, hot tub?
You can do jacuzzi. I find sauna to work a little bit better.
Okay.
But jacuzzi is good. I use a couple of different tools for detoxification. For my really sensitive patients, I'll often use homeopathic promoters of detoxification. For my, middle of the road patients, I often use herbal support for both the liver, kidney, and lymphatics.
Okay.
Those are the most important three to target. And then that's typically my range.
Mm-hmm.
And binders are really important for some people. So binders are things that will, once the toxins are getting secreted out of your liver into your gut, the binders will hold on to those toxins and carry them out in your poop. So those are things like chlorella, charcoal, bentonite clay.
How about this product, Cholesterol Mine? It's a prescription anti-cholesterol binder.
Cholestyramine?
Cholestyramine, yeah, that's right.
I use that almost exclusively for mold toxins, and only this particular kind of mold toxins that are best bound by cholestyramine, like ochratoxin.
Okay.
Yeah. I find that it's not necessary for most of the other mold toxins, and it's definitely not the best binder for other toxins like heavy metals and chemicals.
Okay, so I'd be good to probably go on a general charcoal or something like that.
Yeah, something that's a broader binder like charcoal is usually better.
I understand with the charcoal that you should only go 3 or 4 days with that and then take a break. Is that right?
Well, no, I actually have people do it for long periods of time.
Okay.
But the thing that you have to remember about doing charcoal is that you need to take it 1 hour before or 2 hours after meals and other supplements and medication.
Okay.
So if you were to be taking it near those things, then yes, you have to only do that short term because you're carrying out your nutrition and your medication.
Okay, great. I recently had a C4A blood test to determine my toxicity because I had mold exposure, and it came out real low in the 800s, and so that sounded like an indication that I do not have a mold toxicity.
Yeah, I never use that test by itself. I don't think that the Shoemaker labs are the best way of testing for mold toxicity, but they can give you some indication to get started on whether or not that theory makes sense. But I find urine mycotoxin testing through real-time labs to be the best.
Okay. Okay, so simply getting back that low score on the C4A is not really conclusive as far as my mycotoxicity?
No.
Okay. Okay, that's good. Well, I should probably stay on that cholestyramine for that mold toxin because I was exposed to mold quite severely and was quite ill from that years ago in 2003.
Oh, okay, gotcha. Well, it just depends. Honestly, at this point, if you've been on cholestyramine for quite a while and, the worst effects that you felt from the mold are better, then I would suggest you go off the cholestyramine and do the urine mycotoxin test so that you can actually verify whether or not you have cleared those toxins.
Okay, that's...
Because you don't want to be on any medication that you don't have to.
Yeah, exactly. Right? And who did you say does that uromycotoxin?
From Real-Time Labs.
Real-Time Labs. Oh.
What state are you in?
Oregon.
Okay, great. So in Oregon, they have a special price for Oregonians and Washingtonians, which is $299.
Mm-hmm.
And insurance won't pay for it, unfortunately, but it's a really good test.
Okay, great.